Welcome to Medicine Talk ND Live, where you can discover life without medicine. Join us live 12 to 1 CST every weekday, where you can talk to a naturopathic doctor for free and learn more about naturopathic medicine. ND Live is brought to you in partnership with FullScript, the doctor's choice for delivering the safest source of professional-grade supplements to their patients.
Welcome everybody for our interview with Dr. Holly Castle. Today I'm Dr. Eli Camp, and we are doing these interviews as a part of our Discover Life Without Medicine, our ND Live program, where people can call in and talk with naturopathic doctors for free between 12 and 1 Central Standard Time every weekday and some weekends. This is, something very passionate for me, and I believe in educating, and you don't know what you don't know. So you don't know what choices you can make in healthcare if you don't have all the information or more information than you have right now. So thank you, Dr. Castle, for joining us today on this beautiful, well, here in Oklahoma, it's kind of a rainy Sunday, but rainy and gray. But your practice is in Scottsdale, Arizona, yes?
It is, and it's bright and sunny here this morning, but chilly, which we all wait months for this, except for the snowbirds trying to escape this. They're not as happy as we are.
Right.
But it's nice. It's really very temperate right now.
I remember going to school in Arizona, 110 and 115 in the summer was nothing, and that was rough. But the winters were awesome. Winters were awesome.
Yes.
So you have been a naturopathic doctor for a long time.
I have. I feel like an old timer. I graduated in 1997 from National.
Well, you're in that group. The group we fondly call our elders, right? Our mentors, our teachers. Yes. Well, so you went to National, you said?
I did, in Portland, Oregon. I had a great education. I was so fortunate. And the longer that I'm out, the more I appreciate it. I realized that we really had amazing teachers, amazing philosophy, amazing information. And it served me well this entire time.
How did you come to be a naturopathic doctor?
Well, I went to art school. That's how I started my journey.
Wow.
And I became very toxic from all of the chemicals I was working with. I was in the printing department. There was not great ventilation in those days. I think there was a lack of understanding about that then. And I became very unwell, that's all I can say. And I started suffering from migraine headaches, which I had started to have when I was much younger, but not with the frequency and intensity that it developed into when I was in my 20s after graduating from college. And so nothing was working for me. This is the typical complaint that we hear, isn't it?
It is.
Conventional medicines weren't touching this. And I started looking for alternatives, but there has to be a better way. And so I independently started studying homeopathy. I became very interested in that, and I was buying all my books from this one health food store. And the owner of the health food store said, "You really need a teacher because there are no more books." And so she pointed me in the direction of a course that was being given by Paul Herskew.
Oh, wow. He was your first teacher.
He was my first homeopathic teacher. And there were some amazing docs in this class, and most of them were from Portland, and they all went to National. And at that point, I thought, I want to go to medical school and I want to do this. And so I was taking all the medical school prerequisites. And I had, you can't take a class from Paul and not be hooked. Either by homeopathy or by naturopathic medicine.
Exactly.
Yes, and everyone in there was practicing true naturopathic medicine at that time. They really inspired me. And a group of them kind of colluded and said, "You need to go to National." So I changed direction and I went to National, and I've never looked back.
Wow.
It really is. I love homeopathy so much, and I love our medicine so much. And it served me well because I only rarely now have a migraine headache. For all these years, physician heal thyself, right?
And you're not on a lifelong migraine headache pharmaceutical.
No.
Right,
Never.
which
Never
your
did.
other option, had you not found the naturopathic or vitalistic way to restore your health and balance,
Yeah.
you would be like so many other people out there who are hooked on drugs.
Yes, I would be.
Not by choice. Not by choice are they hooked.
No, not by choice. But I don't take anything. If, in fact, I do have a migraine, I'm able to nip it in the bud, usually with herbals.
Right.
Herbal medicine and homeopathy.
That is amazing. What a great story. So many of our awesome, incredible naturopathic doctors in practice today seem to have a large percentage of them seem to have come from National College. Now that I'm interacting with more and more of our mentors and you guys must have learned something right over there.
Well, it's the mothership, isn't it?
It's the mothership. So, tell us a little bit about your practice then.
Well, I have a private practice. I actually practice from my home. So it's a very quiet, personal setting. I like that because I'm able to develop, I feel, a strong bond with my patients. And I believe that a lot of healing takes place even within the doctor-patient relationship.
I agree.
Yes. So I also treat people remotely, by telephone and Skype and so on. But it still has a personal feel to it because, like you and I are now, we're looking at each other and we're in our home offices, right?
Yes,
so
I'm in mine too.
all our books, and it really is, as we were saying, the way medicine used to be. It was much more relationship-based and medicine-based and science-based. It was kind of a combination of the three.
Absolutely.
One of the things that I think is the beauty of our medicine is it brings back the personal element of the doctor-patient relationship.
Absolutely. Which you need time with a person.
Yes.
In a visit.
Yes.
Yeah. People don't believe me when people that aren't familiar with naturopathic doctors or homeopathy or any of our modalities, when they find out how much time I spend with my patients.
Yes.
Some of them have said, I don't think if I counted all my doctor's visits together in my life, I spend as much time as I have in one or two visits with you.
Yes. Yeah. And you do homeopathy as well.
I do.
And that really takes a very high level of personal interaction and a high level of trust on the patient's part.
Yes. Yes. So, I want to go back just a minute to what you said, like medicine was. When I was young, and I'm 50, I turned 50 this year, and which is really bizarre. I feel like I'm 20, but when I was young, we had a doctor that we were in New Jersey. I was very, very young, who came to our house.
Mm-hmm.
I don't remember in my very early years ever going to a doctor's office. They came to us, and he was in town.
Mm-hmm.
And I do remember going to his house when I was little.
Yes.
And that is what I thought about when I became an ND. I'd love to be the town doctor.
Mm-hmm.
And everyone knows that's the doctor's house and that's where you go.
Yes.
Yeah.
I like that idea too.
So clearly homeopathy is a major part of your practice, and because you're a naturopathic doctor, food, herbs,
Absolutely.
all of that.
Absolutely. I really believe in Hahnemann's principle of removing the obstacles to cure.
Right.
And there's so many ways that we have to do that.
Right.
So I use all of them.
Yeah. Yeah. So we've been asking, were you going to say something? Oh, we've been asking all of our NDs for a little free medical information out there. And what I've been asking everyone is, what's your favorite herb and why?
My favorite herb is probably ginger.
Nice.
Yes, I like that it's warming. I think a lot of people need that. And it's a great digestive, it's anti-inflammatory. There are so many uses for it that we don't even fully understand yet. But I find that it's just a wonderful herb for so many people's complaints, especially digestive.
Right. It's complex. The chemical constituents in ginger, they're still finding, right?
Yes, they are.
That they didn't even know were there before.
They are. But I really am a proponent of using the whole plant.
Me too.
Yes, I think there's a reason why nature presented us with a whole plant. It wasn't to dissect it and tear it apart and just use the part we want.
Right.
The body needs the whole plant in order to really do what it needs to do.
I agree with you. So, last thing, just sort of, because you've been in practice much longer than I've talked with a few NDs about this pattern that I see of people coming in who have developed such severe and long-standing chronic illness.
Yes.
And I think to myself often, if they only had started intervening with naturopathy sooner, the journey would have been, or do you see this too?
I do. I actually feel that people are sicker now than they were 10 or 15 years ago.
Yeah.
And it's it's a very disturbing trend. And I'm finding that things that worked beautifully in my toolbox, I take take longer to work properly because of these obstacles, which seem to be greater. I mean, more
Right.
medicines, more intense medicines, more interference in our environment.
Right.
So,
I feel really comfortable asking you this, which I promised everybody in Medicine Talk I actually wouldn't go in this area, but I'm sorry everybody, I have to do this. So, I believe, I am not anti-pharmacy. I believe that there are times when pharmaceuticals are life-saving, and when nothing else can sustain a life, that the pharmaceutical is necessary, and that there's times you have to have it, like someone who has type 1 diabetes, they have to be on insulin, or someone who has had their thyroid removed, they have to be on thyroid for the rest of their life.
yes,
So,
and I agree.
okay, but I think you said we're sicker than we were 10 or 15 years ago, and this big thing pops in my mind where I say to myself, I wonder how much of that is because of the increasing number of and combinations of pharmaceuticals that people are being put on, as well as environmental toxicity.
Yes.
Right? What do you think?
I'm sorry, I didn't mean to interrupt you.
No.
I think the issue is we're not discerning which pharmaceuticals are life-saving and necessary and which are auxiliary. And so there's this pile up of medicine, and it's getting harder to separate them out.
Right.
And so I don't think that pharmaceuticals are prescribed very judiciously, and that there needs to be more critical thinking in why certain things are being prescribed. I mean, even in our own profession, I think that the critical thinking is the most important part of what we do. And we need to continue that, because even, drug herb interactions can be an issue. We need to be mindful of that. My father was a pharmacist, by the way, and he was a second generation pharmacist. So he and his father were both trained as, old time compounding pharmacists.
Oh, wow. That's awesome.
So I kind of, I grew up in this mentality that you create what you need.
Yes.
And we didn't go to doctors. We weren't We weren't medicated for anything. We didn't go to doctors growing up. It's like, oh, you'll be fine. You'll get better.
Because pharmacists know better.
Yes.
My best friend is a doctor of pharmacy.
Mhm.
And I actually think they should be given some sort of ability to do treatment. They know the medications
They do.
and what not to use and what not to use together.
But not to use together. That's key.
Yeah.
And we know that they do have some latitude today, as they did then, to call the doctor and say, you know, that this is going to interact with.
Right.
I know my father did that quite a lot. But this part of, I think, what the problem is here is they're seeing different doctors. They're getting different drugs from different doctors, and it's hard to separate it all out.
Right. Right. Well, that's why I think concierge medicine is so important, especially when, you know, your concierge doctor is acting as some type of central hub,
Mhm.
so they know what everybody's doing with you and can help. You know, they can help say, well, no, we don't want to go that way. But,
Right. I agree with you. I
yeah.
agree with you. And that's pretty much how I operate my practice as well,
Excellent.
as a concierge practice.
Excellent. They're so needed.
They really are.
Yeah. Dr. Castle, thank you so much for taking the time today to come chat with us. Everyone remember, Dr. Castle is on the phone every month between 12 and 1 Central Standard Time. Check our calendar so you can see when she's there. And all of us here at Medicine Talk, we're so grateful to you for being part of ND Live.
I'm so grateful to be part of ND Live. Thank you so much, Eli, for inviting me to join.
Absolutely. I hope you have. Oh, before you go, how can people find you?
At drhollycastle.com. drhollycastle.com.
Excellent. Excellent.
Thank you.
Have a wonderful holiday season.
Thank you.
I'm sure we'll see each other soon.
We will.
Visit medicinetalk.org to join us at ND Live today. And be sure to ask your doctor about Full Script.